For some analysis, let me turn to Dr. April Spencer. She's a breast surgical oncologist and joins us from Atlanta. Dr. Spencer, what do you make of these numbers, and are you surprised?
Well, first of all, thanks for having me. I am not surprised. I am very relieved that we are shedding light on this global initiative. It's so vital that we really have these conversations today. As you know, World Cancer Day is coming up February 4th, and it is just a good opportunity to have a conversation about what we can do as a global community to help impact this.
So,
One of the things,
go ahead. I interrupted you. Go ahead. Finish your thought,
no
please.
problem. One of the things that's clear, it is a global problem. It's not just a problem that affects developed countries, but also developing countries. And we're all in this together. So we always feel that change first starts by having a conversation. And so I'm really glad we're having this conversation today.
And what's interesting to me, Dr. Spencer, inequalities are particularly pointed in breast cancer. Women in lower income countries, according to researchers at WHO, are 50% less likely to be diagnosed than women in higher income countries. What do you make of that?
You're absolutely right. And what we're finding is where you live should not determine how long you live. What we're seeing is disparity in terms of access to quality care. We also need to help raise awareness. There has been a huge initiative to increase the screening rates, but where there's some opportunity to really try to narrow that gap in underserved communities is just making sure that people understand and are educated on the process and they're comfortable with their healthcare providers. So once we establish a rapport, once we get the information out there, we're finding that patients are more likely to not only get screened, seek the care, but complete the treatment. That's key.
And what does this mean for Black women who are more likely to have an aggressive form of breast cancer?
Yeah, so for women of color particularly, what this means is that we've got to have a trusted medical system because there is a historical mistrust of the healthcare system. So regaining that trust, so it's very important as healthcare providers that we are aware of conscious and unconscious bias and just try to communicate more and establish rapport with our patients that are persons of color, because otherwise it will impact not only the outcomes in terms of how well these patients do, but mortality. We're finding that Black women are dying at a higher rate, 40% higher than their counterparts. And so this is startling, not just in the United States, but worldwide.
And Dr. Spencer, you talked about the importance of having these types of conversations and raising awareness, but do you think that is enough to perhaps reverse this trend, this trajectory, if you will?
It's not enough. It absolutely is not enough, Asieh. What we find is that you've got to move from awareness to action. What are we going to do? And so in terms of education, patients just need to be reminded, regardless of color, just being aware of your body. If you see something, feel something, say something, being aware of the behavior, things like obesity and tobacco use, even the air quality, as you mentioned before, is impacting the increase or spike in these numbers worldwide. C is just consumer choices, being aware of what we're putting in and on our bodies. That is the key. And again, where you live should not determine how long you live. But if we focus on the ABCs, being aware of our anatomy, being aware of the behavior and our consumer choices, I think we can start moving in the right direction.
Well, we certainly hope so. Dr. April Spencer, thank you.